Hi, everybody. So today we're going to talk about the neurological disorders, and there are a lot of different ones of these covered. So I'm going to try to skim over them and hit the high points, but this might be a little bit longer than some of our other videos as a result. So one thing I just wanted to touch base on is the difference between a neurologist and a neuropsychologist. So a neurologist is someone who gets a MD, a medical degree, goes to med school, 4 years, same as everybody else, and then their residency after they get their MD would focus in on neurology. Whereas a neuropsychologist is going to go to a PhD program, typically in clinical psychology, that has a specialization in neuropsychology, do usually 6 years there, including an APA approved internship, accredited internship. And then they might do a postdoctoral study in neuropsychology as well. Neurologists are going to focus more on doing like the physical examinations for things. Neuropsychologists will be using the types of assessments we've been talking about all semester. So these are the types of things a neurologist will do. I was on a multidisciplinary team with a neurologist once to study traumatic brain injuries and treat people with traumatic brain injuries. So I got to witness him do these things. So the physical examination, they'll look at things like reflexes, assessing the different sensations, sensitivity for light, object recognition, blood pressure, all the normal things a doctor would do as well. And then on my team, I also took them aside and did some basic psychological and neuropsychological testing. So we're going to start with cerebral vascular disorders. And this is the most common cause of death and chronic disease in the Western world. And typically when we talk about these, we end up talking about cerebral vascular accidents, sometimes abbreviated CVAs, and these are strokes and infarcts. Stroke is when you have a sudden disruption of blood flow to the brain. A stroke is kind of like a heart attack in your brain, essentially. And then infarct is where you have an area of dead or dying tissue resulting from the obstruction of the blood vessels. And these can range in severity. So here's what bleeding in the brain looks like. As you can imagine, this is never good, just like massive bleeding anywhere else in your body. So an ischemia is a disorder due to blockage in blood vessels going to the brain. So again, think of a corollary of your blood vessels being blocked going to your heart. It's not a good thing. Thrombosis is the formation of a plug or a clot in that blood vessel. And then an embolism is a clot or plug that is brought through the blood vessel from a larger vessel to a smaller vessel, and then that's when it gets stuck. It can be a clot, a bubble of air, or a massive size. And they have cerebral arteriosclerosis. Sorry, sometimes these Latin words trip me up. This is thickening and hardening of the arteries. Again, just like someone who has high cholesterol might experience in the rest of their vascular system. And then you can have what's called transient ischemia or cerebral vascular insufficiency. And this is temporary ischemia, and it varies over time. But obviously, anytime this is happening, it's not a good thing. You can get what's called a migraine stroke. And this accounts for a significant number of strokes in younger people, especially women. So people can have strokes at young age. And these occur with migraine attacks, which we'll talk about later in these slides. It is a transient ischemic attack, or TIA, you'll hear that abbreviated. So they'll get impaired sensory function, numbness, especially in the extremities, difficulties moving, and aphasia. Cerebral hemorrhage is really bad. It's massive bleeding into the brain, most often called by hypertension or high blood pressure. But can be things that are congenital or genetic, blood disorders, having a brain trauma, being exposed to toxic chemicals. Now, angiomas and aneurysms are another thing we want to look at if we're looking at CVAs. Angiomas are congenital collection of abnormal blood vessels that divert the normal flow of blood. So not good, right? That your blood isn't circulating the way it should. So an AVM is where you have masses of enlarged and tortuous cortical vesicles supplied by large arteries and drained by more than one or more large veins. Aneurysms are when you have vascular dilation So it's like a balloon-like expansion in your blood vessels in your brain. Again, never good for the blood vessels to not be doing what's normal, essentially. Most are congenital, genetic, but can happen due to, again, high blood pressure or things like embolism. Now, you can treat these a whole bunch of different ways. There are things that can give people within the first 3 hours after the episode, so it's really important, if you think you're having a stroke, to get to the hospital ASAP. Sometimes you can do a surgery. It's really unusual to be able to do that. It's often not an accessible part of the brain, but there are things they can do. Preventing a stroke is really the most effective. Controlling your blood pressure, which of course also means controlling your stress, and avoiding smoking are huge things. Other thing that in young people is related to strokes is birth control confounded with these types of things. So your birth control will say on it, usually like a warning sign is, don't smoke while you're taking this product. And there are cases where people who smoke while they're using birth control do have strokes. Traumatic brain injuries affect brain function through direct damage. So something has happened where you get a head bump. It can disrupt the blood supply, it can induce bleeding, there can be swelling, infection, and the brain itself can be scarred. Now, one of the things that we often talk about is mild TBI. TBI here being traumatic brain injury. And in lay speak, this is called a concussion. And people tend to just sort of like poo-poo it, like, oh, it's a concussion, no big deal. We even call it, again, a mild TBI. Well, let me show you a diagram that explains why you probably shouldn't do it. So here is what the brain looks like after a mild TBI as composed to a severe TBI. It doesn't look that different, does it? And then especially when you compare it to the healthy brain here, right? So we really do need to be taking concussions seriously. And that's why things like the NCAA, the NFL have put in place very strict concussion protocols. Because we know, especially if you have repeated concussions every time, it can be really problematic and have long-lasting effects. You can also have open head injuries. Phineas Gage that we talked about last module is an example of this, right? He had the rod go right through his head. So this is where you have skull penetration. The neurological signs and symptoms are highly specific to the area that was injured. You can undergo rapid and spontaneous injury if it's small and very specific, and recovery can be remarkable. And the example of this that you have a whole bunch of videos about, just because I'm fascinated by this case, and it's a great example of recovery of functioning, is that of Gabrielle Giffords, who was a U.S. rep from Arizona who was shot point blank through the skull and survived, and has had to learn to adapt to essentially use her speech areas, which are on the left side where she was shot, sort of rerouting them through the right side of the brain. And this is Gabby Giffords. So you can also have closed head injuries, and this is what we typically think of when we think of TBIs. And there's a lot of forces that are not really great here that happen. All right, so let's say you, are hit on the side of the head while you're playing a sport, right? Someone runs into you. So you have the coup. That's where you have the site of the blow. Going to be some damage there. But you also have what's called the counter coup. It's going to be over here, because what happens in your brain is your brain's kind of like jello. And so when it is hit over here, it kind of bounces around in the skull. So you're also going to have some damage over here. Because of that bouncing, you can also have twisting and shearing of essentially your neuronal axon. Again, not great. You can end up with bleeding and pressure. You can end up with edema. And this shows what the coup and the counter coup might look like. One of the things that we can use to sort of assess where someone's at following a TBI is the Glasgow Coma Scale. And this is a great walkthrough of it. So you look at eye-opening, motor response, and verbal response. You can be from all the way oriented, which I hope most of you are right now, right? Or I could tell you the time of day, I could tell you Where I am right now, I'm in my office. It's about 10:30 a.m. right now. And I can tell you who I am. I'm Dr. Taryn Myers. I could obey simple commands if you told me to do certain things. I can open my eyes. So you can see there can be various levels of non-responsiveness, and obviously the lower your levels on the Glasgow Coma scale, the more severe the damage from the injury at that point in time. So in terms of recovery from head injury, it can continue, but usually most of your recovery is going to happen in your first 6 to 9 months. You can get back your cognitive skills, social functions, and personality, again, depending on where you're injured, can be problematic. Gabby Giffords is an example of that not happening. She still has sort of her sparkling personality. And you can prevent it by recognizing, concussions are problematic, trying to avoid sports that might subject you to concussions more than others, like football, soccer from headers, things like that. And again, just immediately, if you're going to play those sports, or if you are in a car accident, getting assessed for a concussion, addressing it right away. Epilepsy is a disorder many people have heard of. This is where you have seizures recurrently. And these can be symptomatic, where you find a specific cause, or they can be idiopathic, where they appear spontaneously and we can't really figure out what the direct cause is. There are 3 common symptoms of epilepsy. You have the onset of aura, which is warning of an impending seizure. You have a loss of consciousness, and there's a motor component. The body can move in very different ways. You can confirm this using that EEG we talked about way at the beginning of the semester. And there are these 4 types of seizures we're going to talk about in a lot more detail. So focal seizures begin at a focal point in the brain and spread. So you can have Jacksonian focal seizure that begin with one part of the body and spread. Or you can have complex partial seizures where subjective experiences precede the attack of seizures. So automatisms, automatic behaviors, postural changes, things like that. Generalized seizures have bilaterally symmetric onset, so both sides of the brain. Grand mal seizures are what we typically think of when we think of seizures. These are the seizures you see in movies, where the person is often violently convulsing on the floor. There are tonic and clonic aspects to these seizures. And post-seizure, you might have some issues sometime recovering from that. So in terms of the tonic and clonic stages, these definitely are very frightening to the person. About half of people who have generalized seizures get an aura beforehand, so that means half don't really have a warning. Petit mal seizures are a loss of awareness, so there's no motor activity. You might blink or roll your eyes or turn your head. They're often very brief. They kind of just look like the person's spaced out. So if the person doesn't know they have epilepsy, they might not even necessarily realize when they're having these petit mal seizures. So akinetic seizures are usually seen in kiddos, and they just sort of collapse without any warning, and these attacks tend to be pretty short. Myoclonic spasms are massive seizures that have sudden flexion or extension of the body. Okay, obviously another issue that can come into play is tumors. So just like anywhere else in the body, you can get tumors in the brain. It's a massive new tissue that persists and grows independently. You can have benign tumors that aren't likely to recur after removal. Malignant tumors are likely to recur. They're progressive and life-threatening. These are typically cancer. You can have encapsulated tumors that are distinct entities that put pressure on the brain, or you can have infiltrating tumors that aren't separated from the surrounding tissue and can destroy healthy cells. So here's where that encapsulated tumor might look like. Here's the infiltrating, and you can see how insidious it is going through the brain. So glioma arises from glial cells and infiltrates brain substance. Meningioma is the most benign of tumors, attaches to the meninges, and outside the brain, it tends to be well encapsulated. A metastatic tumor occurs in the brain after tumor cells transfer from elsewhere. So maybe you have lung cancer, and then you end up with a tumor in your brain as well. Chemotherapy is not really effective here. Surgery and radiation are unfortunately the way you usually have to go. So migraines, or as one of the videos you'll watch for this module says, migraine. So these begin, classic migraines at least, begin with an aura that lasts 20 to 40 minutes. And that occurs because of vasoconstriction, so your veins constricting in the occipital cortex, back here. And you get a headache, and it's not just a headache, it is incapacitating. Intense pain, it's mostly localized on one side for most people, but it's so severe people can vomit, be nauseous. They often just have to like be in a dark room with no sound and lay down until it passes, and it can last for hours or days. And you can get a scotoma as a result of migraine, and this is an illustration of what that looks like. Common migraines are the most frequent type. This is about 80% of migraine sufferers. There's no clear aura, but you might have something else you recognize in your body that tells you a migraine's coming on. Cluster headaches are where you have unilateral pain, and they're short duration. They recur repeatedly. Hemiplegic migraine and ophthalmologic migraine are both relatively rare, and you get loss of movements of your eyes and your limbs on one side. Now, another thing that can happen in the brain is viral infections. So just like you can get viruses that affect anywhere else in your body, they can also sometimes affect the brain. So a virus is an encapsulated aggregate of nucleic acid made of either DNA or RNA. So if you think back to like high school bio, these things should be bringing up for you. What makes viruses so problematic is they get into our own cells and use our DNA and RNA to so you have neurotropic viruses. These can be things like rabies and polio, things that we have excellent vaccines for now. These have a special affinity for central nervous system cells. They love them some brain or spinal cord, and obviously lots of severe consequences as a result. Pantropic viruses, things like mumps or herpes, attack sort of indiscriminately. You can also get bacterial infections. So bacterium is a microorganism that has no chlorophyll and multiplies by simple division. Bacterial meningitis is one that's really frightening. Often is fatal if it's not caught right away. And then brain abscesses are secondary to infection somewhere else in the body. And basically cells die off and the bacteria just replicate, and that puts pressure on your skull. You can also have mycotic infections, which are invasion of the nervous system by a fungus, also not great, as you can imagine. You can have parasitic infections and infestations in your brain as well. So amoebiasis is dysentery. And so it's caused by infestation of this protozoan amoeba, and it results in encephalitis and brain abscess. And then malaria, so the disease that's transmitted by mosquito bites, produces local hemorrhages and degeneration of neurons. So again, diseases that in the Western world we've largely been able to prevent or eradicate cause just horrible consequences. Next, we're going to talk about multiple sclerosis. And this is a demyelinating disorder. So what that means is that the myelin sheaths on your axons actually start to go away. And that makes your neurons less efficient. And think about if you took an electrical cord and took the insulation off the top, right? So you might either get like sparks or just it wouldn't transmit electricity as efficient. This is what happens to your brain in MS. So you can get sclerotic plaques that are small, hard, circumferential scars where the myelin sheath has been destroyed. We don't really know what causes it. Some people think it could be an infection, bacterial or virus. Some think it's an autoimmune disorder. Your central nervous system starts attacking itself, essentially. There's possibility it can be environmental factors, maybe a genetic cause. I actually worked in an MS clinic while I was on my residency, and it is devastating because you just have deterioration of your ability to move. Your memory is really affected by it. And when I was there, one of the hardest cases for me is that there was a 17-year-old girl that was diagnosed with it. We typically see it much later in life. All right, so that was a whirlwind tour. Hopefully y'all can follow, and hopefully this was helpful.